Get started. Okay, so good morning, everyone, and thank you for joining us for today's webinar on mental wellness in agriculture. My name is Adam Brome, and I'm an administrative coordinator with SARM. We're going to start off today's webinar with a brief introduction to the Adobe Connect platform. We will then transition into the main presentation, followed by a Q&A session. This webinar will be recorded, and a copy of the recording will be available on our website under the webinars page following today's session. To maximize your audio and video quality during today's webinar, please either join through Google Chrome or the Adobe Connect desktop app. We have posted a link to the download desktop application in the lobby layout, but I will also post it into this chat in just a second. The chat box is located on the right side of your webinar window, and it is visible to all webinar participants and facilitators. You can use this to connect with other attendees, bring any technical difficulties to the speaker's attention for troubleshooting, or to provide any other comments and/or feedback. There's also a dedicated question and answer box labeled Q&A, which is located right underneath the chat box. This is where you can submit any questions that you may have regarding the webinar content throughout today's session. Please do not submit any questions through the chat box. If we run out of time before your question has been asked during the Q&A session, our presenters will follow up with you directly offline following the webinar today. There will also be a copy of today's presentation available for download during the Q&A portion of the session next to the chat box. Please let me know in the chat if you are unable to download the file, and I will email it to you directly. And again, if you're experiencing any technical difficulties today during the event, please notify us in the chat box, and we will do our best to troubleshoot. Now, without further ado, I will hand it over to Dan Florazone with the Johnson Shoyama Graduate School of Public Policy, who will be moderating today's session.
Thank you so much. I just want to do equally a sound check just to make sure everyone can hear me. I'm going to take that as an affirmative. Thank you very much for this opportunity and for spending an hour with us this morning. We had an opportunity to have a bit of a pre-discussion just as we were getting ready and prepared to launch at 10 o'clock sharp. And I can tell you the more the conversation went on, the more excited I got about the panel, about the connections that we've had and the paths that we've crossed, the people that we know. And I'm sure the next true Saskatchewan conversation was who we're related to and whether or not we're related to each other. In some way, that degree of separation isn't that far, and I look forward to the conversation. What I really appreciate about it is that connection, the connection amongst people in Saskatchewan and with people, and that's really at the heart of SARM and the main benefit of these types of presentations and conferences. So today, mental wellness in agriculture is such a critical topic. It's timely. We hear words like crisis in terms of all of the stress, the need for resiliency and what that means, how we seek support, also the use of the terms and the ability for us to feel confident in today's age to speak openly and more openly, reducing the stigma around mental health and mental wellness. So I want to thank you for being here, and without any further comment, I want to go through and introduce all three of our speakers today. So who I'll start with is Adam Chomos. With Adam, after earning his BA honors in psychology, Adam completed his Master's of Science in Kinesiology and Health Studies from the University of Regina. Among his many passions, Adam has spent the better part of his professional career in organizational training roles, working with business professionals, athletes, and high performers to elevate their cognitive and mental performance. As a workshop facilitator with Bridges Health since November of 2018, Adam has been blessed to work with various organizations that are looking to adopt and create workplace cultures that are psychologically safe and inclusive of mental health awareness and initiatives. Adam is incredibly excited to share his knowledge and experiences around mental health and wellness in hopes of empowering individuals and organizations to function as happily and healthy as possible. So just by show of a hand, Adam, if you want to just raise it, just let everyone know who you are. That's great. Kendra Ulmer is a registered nurse at the Canadian Centre for Health and Safety in Agriculture at the University of Saskatchewan. In the Extension Division of the Agricultural Health and Safety Network. Kendra has thoroughly enjoyed the last 16 years as the network nurse, working with many wonderful RM administrators, counselors, SARM, the farmers throughout the promotion and delivery of network programs. So many of you will know her by name and certainly recognize her. Kendra grew up and currently lives in rural Saskatchewan and is an active team member in her family's mixed farming operation. As a wife, mother, daughter, sister, farmer, and healthcare professional, Kendra is immersed in current agricultural production and health and safety issues. This background allows her to identify and act on the health and safety needs of Saskatchewan farmers, their families, and agricultural workers. So Kendra, just a hand just to say hello, and wow, it's a privilege to have you here. Dr. Niels Koehncke is a physician and specialist in occupational medicine at the University of Saskatchewan and director of the Canadian Centre of Health and Safety in Agriculture. This specialty in his role is really quite unique in Canada. His passion is workplace health, wellness, and safety, and he has over 20 years of experience working with a variety of industries from the medical point of view, including agriculture. He has previously served as the Chief Occupational Medicine Officer for the Ministry of Labor Relations and Workplace Safety up until about 2 years ago. Although born and raised in Alberta,
No worries. There we go.
Dr. Niels Koehncke was born and raised in Alberta. He has lived in Saskatchewan since 2000 and is officially a Riders fan. So we're so pleased to have a convert. He lives with his wife and 2 children on an acreage east of Saskatoon. And we're going to start with Dr. Koehncke. Thank you so much for joining us, and thank you for choosing Saskatchewan as your place to be for the last 20 years.
Yeah, that's probably the most important piece there to make clear for me to be able to continue to speak, I think, right? It really has been invigorating having the conversation ahead of time. I think there's been a lot of shared connections before, and it's just I grew up, although like you said, raised in the city in Alberta. My father moved here seeking work as a farmhand, and all our German relatives and friends growing up were farmers, and I just grew up around and sort of immersed in that environment, especially in the summers, and have really felt a connection to that industry well prior to my medical training, and it's just been a privilege to be in this role for so long. And this topic is near and dear to me and is a really important one, I think, and I'm glad to see it's getting traction and attention in agriculture, in a lot of different industries, but in agriculture as well. And I was lucky enough to also be involved with the Canadian Standards Association in the development of their standard on psychological health and safety in the workplace. And it's something I think a lot of employers in other industries are really recognizing and taking hold of as something that's important. And we hope to do the same with agriculture because it is so crucial. And thank you to SARM. Thank you to for giving us this venue, for letting us participate in this, and thank you to Bridges Health, of course, and Adam for facilitating and putting this together. This really looking forward to being part of this. This is our home on campus. We're on the first floor of this is the Health Sciences building. The Canadian Centre for Health and Safety in Agriculture has been around since 1986 and founded by Dr. James Dosman, who many of you know. And we're a research and outreach center
And Dan spoke to the outreach piece already, and Kendra's heavy involvement in that. We have other faculty and staff engaged in really relevant and important research for rural Saskatchewan, for farming, for agriculture, but also other rural issues that are important to Saskatchewan. And we're lucky to be where we are. I think we have a lot of great connections with other colleges, with engineering and the vet college and nursing and toxicology and other places on campus that really help us ask the right questions and come up with solutions to problems that are important for rural Saskatchewan and for this industry. The network has been around almost as long as the center, founded about 2 years later. And again, I think it's true for pretty much everything that is agricultural medicine related in Saskatchewan and in Canada to a large extent. Dr. Dosman, his name is tied to the start of it. And what started out as, I think, 5 or 6 RMs in 1986 has ballooned to well over 200. And forgive me, I'm not sure that this particular map is the most current. We have a sort of an updated map that runs around with us, but we're just delighted to be able to offer our services, our webinars, our access, to the clinics that Kendra will talk about, and resources, to our member RMs. And we're just very grateful to the RMs that are members, and we certainly encourage RMs that aren't to please consider joining or to reach out to us to have a conversation around that. And if your RM is not, or you're not sure if it is, find out and certainly reach out to us about joining. The network is the Ag Health and Safety Network is kind of the outreach or the extension division of the center, and its mission is to improve health and safety on the farm by a variety of means, including education, service, and studying and evaluating the effects of that and of the education and service to see what works and what doesn't. It's very unique. We're not aware of any setup like this in other provinces at all. It's safe to say it's one of a kind in Canada, really focused on what's important in Saskatchewan on the rural needs and on agricultural health needs. As Kendra will talk about, we can provide health screening, lung respiratory testing, hearing testing, health promotion, education, training, resources. We're one of the more active services that we provide now is something called Discovery Days, where we reach out to school-age children and with a number of resources and in-person or virtual health and wellness and safety discussions. And this is sort of a look at the Discovery Days information, and it's something that has really gained a lot of traction. Has been very, very popular and continues to be in high demand, and we've reached thousands of school-age children over the last few years. Despite the pandemic, I think we've managed to been able to continue that virtually. So certainly would encourage, if there's any interest in that locally with rural schools and divisions, encourage some participation there. I'll stop there and turn over this next part to Kendra on discussion of the rest of the network and a little bit more about the services we offer. So thank you for the opportunity, and I really look forward to this discussion and the webinar.
Thank you, Niels. Can everyone hear me okay? Thumbs up. Okay. Good morning, midterm SARM delegates. I miss seeing everyone's face, but I see lots of names in the attendees that I recognize, and I look forward to visiting with you in person soon when it's safe to do so. I would like to take this opportunity to thank SARM for the invitation to participate in this unique webinar series. This really allows the network to highlight very briefly some of our current programming and to offer our feature presentation today, Mental Wellness in Agriculture. And this is all part of a larger Fostering Mental Health Resiliency for Farmer Network CAP project. As the network nurse, I'm really looking forward to getting back in the RM offices in the very near future when safe to proceed, to offer the one-to-one health clinics for farm families with the focus of either respiratory or hearing health, and also offering the hearing loss prevention clinic for RM employees. We will resume also offering these in CCHSA offices upon request. So if your RM is interested in hosting a clinic or has more questions about what's all involved, please reach out to us. Agriculture is rooted in strength and resiliency, and the network understands now more than ever that farmers are facing tremendous pressures in addition to the ongoing COVID-19 pandemic and the 2021 drought in Saskatchewan. All too often, farmers silently suffer through mental challenges and stress, and this needs to change through providing tools and support for producers to continue to increase awareness about mental health in agriculture and truly foster a culture of resiliency. On behalf of CCHSA, the network is thankful to have received funding through the Canadian Agriculture Partnership, or CAP, Farm Safety Program to support the development and delivery of a number of projects, events, and complementary resources, all part of the Fostering Resiliency in Ag grant. In April of 2021, the network partnered with Bridges Health and Do More Ag, both organizations having extensive experience delivering health and wellness workshops and training to the agriculture community. And together we delivered 4 Walking the Talk mental health in agriculture webinars. Thank you to the Ministry of Ag for your support and promotion and facilitation of these webinars. The webinars were well received by the farming community in Saskatchewan. In effort to continue to reach as many farmers as possible in a variety of methods, the network has continued to partner with Bridges Health to develop a new resource, Fostering Mental Health in Agriculture, the Importance of Self-Care and Stress Management to Maintain Mental Health, which is currently in the print process as we speak, and it will be available on our website very soon. The first hard copies will be launched at the Ministry of Agriculture and CASA trade show booths at Agribition in a couple weeks on November 22nd to 27th. The network will be spending some time at each of these booths, and I look forward to offering you the resource there. It'll also be available in December at our network RM offices. We also look forward to a series of short 5-minute videos from the Bridges Health team on a variety of topics that all support this initiative. And some of those topics may include tough talks, navigating change, mindfulness, setting healthy boundaries, supporting within our means. And these will be available on our website in December also. In addition, we will be partnering with some other health professionals for a series of winter webinars. So watch our website, social media, and SARM Communications for upcoming events. Thank you to the Ministry of Agriculture, SARM, and our network membership for your dedication and support in promoting farm health and safety programs and resources in Saskatchewan. In closing, I would like to thank all of you as Saskatchewan producers and rural municipal leaders. Thank you for your work and dedication in fostering safe and healthy communities and producing high quality food for our world. We understand that with farming and ranching, there are just so many stressors that are simply out of our control. Your strength, resiliency, and perseverance are admirable, and you are the backbone in Saskatchewan. Thank you for taking the time today to invest in your health, learning about practical tips that we can control to take care of ourselves and foster resiliency in agriculture. Remember, you are your families, your farms, your RMs, your community's most valuable asset. Take care. Together we can stay safe and healthy on Saskatchewan farms. I'm very grateful to have Adam Chomos from the Bridges Health team with us today for our feature presentation, Mental Wellness in Agriculture.
Great. Thank you so much, Kendra. I'm just going to double check and make sure that my PowerPoint clicker is working as it is intended to. Give me just 10 seconds here. Thank you, Dan, for the introduction, Niels and Kendra for kind of the introduction and segue into my conversation here today. Doesn't look like my clicker is working, so I'm just going to look to do this a little bit more manually, which is all good. So my name is Adam Chomos again from Bridges Health. Thank you to SARM for having myself out to share my experience and my perspective around mental health. I think that before we dive into the content here this morning, it's important for me to shed a little bit of a lens in terms of what I bring into this conversation here today. I have been very, very blessed over the last couple of years to have had the opportunity to work with a number of different organizations that are very similar to the folks that are in attendance here today. I've had the opportunity to work very closely with the likes of FCC. I have had the opportunity to go to a number of different sites throughout the Nutrien plants and throughout the province, working with the folks at Nutrien over the last couple of years. And I've had the opportunity of delivering, especially during our COVID times, a number of webinars to the likes of the Do More Ag Foundation. So it's an honor to have the opportunity to be here with each of you, to again be here to learn and to share with each and every one of you. The other lens that I bring into this conversation here with you, more generally speaking, is one very heavily rooted in mental illness. As someone who has lived with a very debilitating gambling addiction for the better part of the last 30 years of my life, an addiction that saw me live a double life away from my wife and my immediate family, a double life that saw me gambling hundreds of thousands of dollars, millions of dollars, hiding hundreds of thousands of dollars in hidden offshore accounts across the world. An addiction and a double life that eventually saw me hit a very dark and difficult time in my life where I knew that one of two things were going to happen. Either I was going to have to find the strength and the courage and a word that we're going to talk a little bit about here today, a word that at that moment in my life I knew nothing about, called vulnerability. But I was going to have to find it to come clean. Or choice B, choice two, I knew that I had come to the end of my life in this life. I had spent the better part of the last several months of this dark moment in my life writing letters to my family, letters explaining my choice to take my own life, because I didn't need to do a lot of digging around and research to convince myself, to convince anyone that was close around me that a life where addiction wasn't running rampant through it in my household, that their lives would be far better off without me in it. And so very, very grateful, with gratefulness, I am here in front of you sharing my story, sharing my perspectives, my journeys through mental illness and into mental health. And I so look forward to having this opportunity again here today with each of you. Truthfully, we could probably spend what we're going to be talking about, wrapping into about a 40-minute segment here. We could spend the entire day talking about any one of several little topics. And so it's going to be at a bit of a fast pace here. As Adam mentioned at the beginning, we will have a little bit of a Q&A segment at the end. And if we don't have time to answer all of the questions, my support to you, Bridges Health support to you, does not end when our webinars do. And so you will have the opportunity to ensure that your questions, your requests for clarification, that everything is addressed in the near future. So just as a couple of high level overview of some of the things that we're going to be talking about, we're going to introduce the idea of mental health and how it relates to what we all strive for, overall well-being. We're going to talk about something that is very, very close and connects every single one of us that's here today, every single one of you that's here today. Stress, burnout, anxiety, how they're prevalent on the farm, in farm life. We'll gain a basic understanding of some of the more common mental illnesses. And then we're going to spend some time talking about stress management. We're going to spend a little bit of time talking about resilience, something that we need to give ourselves credit for during these times especially. When we take a step back and we look at the idea of mental health, and we look at some of the definitions that have come to us from professionals, from physicians, from organizations like the World Health Organization, mental health is a state of successful performance of mental function, resulting in productive activities, fulfilling relationships with people, and the ability to change and cope with adversity. The reality is if I were to ask every single one of you the simple question, how healthy do you feel? The majority of us would very, very quickly place physical elements of our well-being when we start to answer that question, right? We would think about, well, how much exercise do I get? How healthy am I? Or how much? What is my diet like? How nutritious do I eat? Those types of things. But we have to remember that when we think about this totality of health that we all strive for, we have to take into account social elements of our health, right? The degree of social competence, the relationships that we carry every single day. And we have to take into account the impact of our mental health, the impact of our mental health that brings this totality of health into consideration. So we have to consider multiple facets. When we take a step back and look at some of the most prevalent mental health facts, and then apply some of those mental health facts into the context of our agriculture professions, of our farm life, of the livelihood that each and every one of you have and bring every single day. According to a 2018 national survey of farmer mental health involving approximately 1,100 farmers, producers across Canada, we're going to talk about some fundamental statistics here. But before we do that, I think we can even take a further step back and understand some fundamental basics that 1 in 5 Canadians will experience a mental health illness through their lifetime. That 1 in 5 Canadians will experience a mental health problem every single year. But those numbers are very safe. And the reason that we know that the 1 in 5 number is very safe is because of the idea of disclosure. That in order to be a part of those statistics, you have to be willing to disclose that in fact you are struggling, that you have been going through something challenging in your lives. And when we fast forward, when we go back in time, especially over the last 5, 6, 7 years, we have come a tremendous way of reducing stigma, at creating platforms that allow people to feel empowered, to open up and to share about what's going on in their lives, to tell those difficult stories. While we've come a tremendous way, we're not there yet. There's a lot more work that needs to be done. So that 1 in 5 that I call safe is actually probably closer to about 1 in 3 or 1 in 3.5. Mental illness affects people of all ages, education, income levels, and cultures. It does not discriminate. And we all know this. And we know that suicide is one of the leading causes of death in both men and women from adolescence to middle age. And when we apply some of these fundamental statistics and data into the context of agriculture, we see some even more alarming statistics, that 35% of our farmers meet the classification for clinical depression, that almost half of our farmers report high stress. This is something that is not news to any single one of you here. That over half of farmers meet the classification for anxiety. And we're going to talk about this and understand as to why this is the case. It's not hard for us to understand. 68% of farmers are more susceptible than general population to chronic stress, which can lead to the idea of comorbidity, right? The fact that we're more susceptible for developing multiple onset physical, mental health problems and illnesses down the road as a result of that. When we talk about the idea of stress, again, something that I think for the most part really connects every single one of us that's here in attendance here today. Stress being the tension that one feels dealing with the pressures and demands of life, that it can be external and it can be related to our environments. It doesn't just have to result in our perception of what that stress is, that it can be external. And that it can also be created by internal perceptions that cause an individual to experience things like anxiety, a number of negative emotions surrounding a very, very specific situation. So when we think about stressors in agriculture, some of the top of the line things that come to mind, Things like weather and uncertain crop yields. Is there a profession? Is there a livelihood on the face of the planet where the impact of that uncertainty can be so influential from a positive standpoint, but also from a devastating standpoint, right? Is there a profession and a livelihood where that uncertainty can be so influential and so potentially devastating? When we look at the financial stressors, debt is a fact of farming and doing business in farming. According to Statistics Canada, from sometime, I think either in 2017 or 2018, farm debt exceeded 100 billion, and that number is just continues to rise. It will continue to rise. Long working hours, strenuous physical labor, doing too much in too little time. And when things like machinery breakdowns and the implication on production during critical times, it's understandable as to how and why those create highly stressful circumstances. And one of the largest ones, isolation, more isolation than most profession. Add into the fact what our pandemic has brought, right? When we think about the isolation that our pandemic has brought over the last couple of years, and then add into the fact what the profession of farming and the livelihood of farming brings to that. Again, it's understandable as to why, such high stress has amounted as a result of that. These are just some of the top end stressors, right? But our stressors, additional stressors, from workloads to weathers to large debt to the livestock well-being, the working hours, the disagreements with family members in the operations of the farm, to the machinery breakdowns, handling of dangerous goods, lack of rest, right? It never ends in this industry. But one of the ways that I like to explain this idea of stress, and this isn't something that necessarily was originally applied into the context of farm life or agriculture, but the way that we understand stress more holistically and generally speaking, I like to explain it through this stress curve right here. So when we think about on the green zone of stress under load, this is what I like to commonly refer to as the Netflix binge day. So this is when I get home after an extremely long week of work, I walk in the house, I see my wife, we lock eyes, and we don't have to say a word to one another, but it's through that locking of the eyes that we acknowledge that in the next 48 hours, we are about to take down an entire season of Pick Your Poison. Yellowstone, season 4 just came out. That's our poison. But it's where emotionally, physically, mentally, cognitively, we're not really willing to give much, maybe the bare minimum to our kids. And that's okay. It's important for us to experience that stress underload from time to time. One of the biggest misconceptions around the idea of stress is that all stress is bad, when we know from a literature, from a research standpoint, that this isn't the case at all. I was very lucky when I finished my graduate studies in the field of kinesiology and health studies. This is one of the things that we looked at very, very heavily, this idea of optimal stress. And it isn't very big surprise that the idea of optimal stress originally was studied amongst our quote unquote high performers, our military personnel, our high performance athletes, to try and understand why is it when some folks, when some individuals and groups are placed with a number of physical and emotional and mental challenges that they find that ability to take it up to the next level. Right. And so what originally started out at looking and investigating these high performers that are faced with a number of these barriers and challenges in their day-to-day life, one of the most incredible and exceptional things about this early research is how replicable it has been to every walk of life, to everyone of every profession, whether you are a physician, a farmer, a stay-at-home parent, an educator, or a teacher. Right. And what it's done is it's taught us that when placed with stressful conditions or stressors upon us, that when we learn to activate it properly from a brain, from a psychological standpoint, from a physiological standpoint, that we can actually produce very, very positive outcomes. So there is such a thing as optimum levels of stress. Where we need to be careful is when we move into the orange zone of stress, the stress overload, something again that every single one of us can speak to very, very personally about here. But one of the important things that differentiates the orange from the red zone of stress is the fact that stress in the orange zone, the stress overload, it's typically short-lived. We navigate from a state of mental health to a state of mental stress, and then we apply one of the many learning strategies, coping mechanisms, things that we've kind of put into our tool belts over the course of life that help us navigate and deal with that stress. And it brings us back into that state of mental health. So it's defined as being short-lived, where we need to be very careful of, and something again that I can speak to from very, very personal experience, is when that stress that we experience becomes untamed, when it becomes pent up and unmanaged for too long, the more likely it is to turn into complete breakdown, where we no longer have that ability to use and to sift and to pull from resources, tools, strategies, mechanisms at our disposal. Those no longer work, where now we rely on the support of others. We fall into that state of breakdown where now whether it's relying on others or relying on things like therapy, counseling, medications, things that are no longer out of our control. There's a very fine line between knowing and feeling like you have things completely in your control and to falling down that slope into complete breakdown. And again, that's something that I can speak to in my own journey of mental illness very, very greatly about. So this is just a way that I like to present the idea of stress to help us understand how we navigate stress, navigate our day-to-day stress, our short-term and our long-term stress. But when we think about some of the more common types of mental illnesses, it's easy for us to look at these common types of mental illnesses more holistically and generally speaking, but then also kind of hyper-focus on some of the most common prevalent types of mental illnesses that we see within our agricultural sector, within our farm life and our farm livelihoods and farm professions. When we think about the idea of mental disorders, there are many different mental disorders, with a number and various presentations. Generally speaking, they're characterized by a combination of abnormal thoughts, abnormal perceptions, abnormal emotions, behaviors, and relationships that we carry with others. So when we're looking at the slide here and looking at some of the characteristics, disturbances in those emotions, disruptions in the function of various brain circuits, the way that abnormal functioning of synapses that connect certain regions of our brain together arise from complex interplay between genetic and environmental factors. So there's a number of different factors and elements that are in play here. And when we think of some of the most prevalent and the most common types of mental disorders, we've all probably heard of, our depression, of anxiety, such as generalized anxiety disorder, panic disorders, phobias, obsessive compulsive disorders, bipolar, PTSD, schizophrenia, and personality disorders such as borderline personality disorders. Anxiety, when I think about, and when I've had and been very, very lucky to share in some of these conversations in the farming industry, it's very, very easy for us to understand why anxiety is so prevalent within the farming livelihood. When we look at some of the psychological signs and symptoms that are associated, the fear, the sense of impending doom or danger, the excessive inappropriate worry. From a cognitive standpoint, our decreased attention and our concentration. So fear is felt even when a threat isn't present. And it's really, present. And it's very important for us to note that the threat or the danger, that it isn't necessarily present, but the individual feels that one is there. The decreased attention and concentration is obvious because the brain is so devoting its resources to that worry about what's going to happen in the future. And when we remember what the statistic that I presented earlier, that 58% of farmers meet the criteria for clinical anxiety disorders because of that uncertainty, of what the future in farming livelihood is about, in the profession of farming, right? It's easy for us to understand and appreciate why anxiety over that uncertainty, why once again it is so prevalent. What's interesting when we look at some of the physical and the physiological components of anxiety and the way that anxiety manifests itself from a cardiovascular standpoint, chest pains and rapid heart rates, respiratory to neurological and gastrointestinal and musculoskeletal. If I were to ask every single one of you right now to tell me, you know, when you think of or when you see some of these signs and symptoms that are present on the screen here, and I were to ask you, what do you think this person is about to experience? There's a good chance that the majority of us, at least at some point, would think about something like a heart attack or a stroke. And it's important for us to understand that mental health manifests itself in very, very physical and physiological elements, that sometimes when someone has experienced something from a mental health standpoint, we need to, and we're, you know, exposed to a number of signs and symptoms from this individual or even within ourselves. It's important for us to take that step back and to ask ourselves, is maybe there's something going on behind the scenes that what it is that I'm experiencing or seeing in this person, it isn't telling the whole story. Mental health manifests itself in physical and physiological, just as we can say from the flip side of things. Depression. That when we look at some of the fundamental signs and symptoms of individuals who experience depression, this isn't simply the blues or someone feeling down. And it isn't about diagnosing a disorder. These are some of the signs to be aware of. And this is really important. And one of the things that we're going to talk about that unfortunately we won't be able to spend as much time talking about, but when it comes time to the understanding of, you know, what is within my control to support someone who's experiencing a mental health problem? Well, being aware, noticeable observations, things that are within our control to pay attention to, whether it be someone that, you know, is very, very close to us that we need to have a conversation with, or signs and symptoms in ourselves that maybe we feel we need to reach out and have a conversation about something that's happening with ourselves. Some individuals might have a flat personality. They might come across this way, according to some of the signs and symptoms that we're looking at our screen here right now. And that's okay. Having feelings of being emotionally blunted or numb, feelings of hopelessness that we experience, that personal blame and shame, loss of enjoyment in favorable activities, decreased energy. But again, what we need to be careful of is when we see these signs or symptoms in others, never should we feel empowered to be able to diagnose something or someone for experienced depression. But this gives us that opportunity to pay attention to those things that are within our control to see in somebody else. When we look at signs and symptoms of depression, especially within the agricultural sector, within that farm livelihood, the idea of isolation can make situations extremely more difficult, much worse. Agriculture, from our research and literature on this topic of agricultural livelihood and depression, we have some very fundamental statistics and data that drives us to understand how important it is for us to be having these conversations. That agriculture is one of the most stressful occupations. We've talked about some of those things. Farmers are subjected to very stressful conditions that affect their success and their failure. The uncertainty of the weather, the fluctuations in the market prices, fluctuations in input costs, disease outbreaks, machinery breakdowns, government policies that regulate agriculture. The reality is that farmers have little control over a lot of these make or break factors. Many of these factors that have a financial impact that can threaten the ability to hang on to the land and the resources needed to farm. What about things like environmental conditions that can impact health and safety of the farm operators? exposure to hazardous chemicals, air, water contaminants that affect the nervous system, right? We talked about the fact that what impacts stress is not just internal in perceptions, it can be external in the form of those noxious agents that we are exposed to, that you are exposed to, that can have a negative impact on our nervous system. And it's true that manufacturers have done a lot to try and make machinery safer so that farming-related injuries and fatalities, those numbers have gone down over the last couple of decades. But it's also true that more needs to be done from a psychologically and a physiologically standpoint to make that farming less strenuous. And then personality traits. Personality traits of successful farmers can also contribute to the susceptibility for developing depression and related clinically depressive illnesses. Traits like willingness to take risks, carrying a high conscientiousness about the work that they do, greater capacity to persevere in the face of adversity, self-reliance. When stress occurs, most farmers work harder to keep things going, to keep those problems inside rather than reaching out for support when those times come. And substance use. Substance use as it relates to, generally speaking, and then to the agricultural sector and to our farm livelihoods. A number of different elements around substance use disorder that are on the screen here right now, a lot of signs and symptoms. But when we think about the idea of substance use disorder, or SUDs, including things like the misuse of alcohol, methamphetamines, prescription drugs, and other illicit drugs, they are a growing problem throughout the nation, especially within North America and people living in rural communities. People that live in rural communities absolutely are not immune to the impact of substance use disorders, and we know this. Data and research that has really started to offer a glaring picture of the impacts of SUDs in rural communities. Again, looking at it from the lens, or in the lens of North America, abuse of opioids, right? Also known as our painkillers. Very much a concern in the farming communities across North America. According to the Centers of Disease Control and Prevention, those opioids or painkillers are prescribed for about 20% of farmers or farm workers who are injured and unable to work. Upwards of 75% of farmers reported being directly affected by opioid misuse. Addiction to things that contain all the way from standard painkillers all the way to the things like heroin and fentanyl, things that are very deadly. Overdose, family overdose situations. So the idea of substance use disorder, especially when we talk about things from an unhealthy coping strategy, unhealthy coping mechanism standpoint, we're going to talk about healthy coping strategies to mental wellness, right? Substance use disorder for those individuals who have unhealthy coping strategies, who rely on substances, behaviors, not just from a substance, from an alcohol and a drug standpoint, but also things like gambling, right? Addiction to behaviors that continue to be unhealthy coping strategies. So when we think about what helps us to have healthy or optimal health, well, there's a number of fundamental strategies, things that are within our control to engage in very, very regularly that have a positive impact. Coping strategies, self-manage or stress management, resilience, something that we're going to be talking about here in a few minutes. And when we think about some of the most common and healthy stress management techniques, especially in my conversations in communities with the likes of, like I said, with Do More Ag and with Nutrien solutions, something as simple as of ensuring that we're getting enough sleep in our day-to-day. The physical manifestations of sleep deprivation are similar to what happens when we have a 0.08 concentration of alcohol in our bloodstream. Right? We understand that lack of sleep, it impairs our decision making. It impairs, from a cognitive standpoint, things like our reaction time. It increases the likelihood of things like mistakes. It can cause you to cut corners and take more risks. And when we think about, again, in the farming livelihood and in the profession and the impact that that can have. So it's important for us to understand the impact of simply something as simple as getting enough sleep. When I like to talk about coping strategies, I like to kind of place them in 4 buckets like we're looking at right here. So when we talked about the fact that the stress that we experience, that we navigate every single day, we navigate from a state of mental health to a state of mental stress. And then we apply strategies and mechanisms that bring us back into that state of mental health. Well, the majority of those that we kind of bring into our toolkits, our tool belts, these are what I like to refer to as the calming strategies, that when something happens to us in the face of stress, those calming strategies that we've learned over time that bring us back into the face or back into that state of mental health, reading the book, the meditation, the breathing exercises, the just getting up and engaging in some physical activity, listening to some music, walking, right? Something taught us very, very early in life or throughout life that just simply by engaging in them will bring us back into the state of mental health. Emotional, here where we're more intentional around the emotions that we experience. And I have a great example of this one, not for me personally, but my wife. From the moment that I came clean to her about a person and a life that she had no idea about, it did rip her life apart. It ripped a lot of my family members' lives apart when they learned about some of the things that I engaged in order to fuel that gambling addiction. The reality still exists today that when Adam hits the road to go and deliver a keynote talk or to engage in one of these conversations, she can't help but have those thoughts run rampant that says, you know what, is Adam being truthful? Or is Adam just out on another bender? Is Adam out at casinos? Is Adam engaged in this double life again? Journaling has been her saving grace. For her to be able to put down on paper some of those thoughts, those beliefs, those perceptions, those attitudes, because it's helped her to be able to take a step back and say, you know what? This isn't in my control. This is out of my control. It's helped her to adopt more healthy perspectives. So being intentional with our emotions, something like journaling, has been tremendous in her life and in my relationship with her. Action-based solutions to stress management, where now we are more intentional with involving others around us, talking to our family, our neighbors, our community members, our teams, to discuss when things are bothering us, to ask questions around mental health supports, but to be very, very intentional with involving others around us is so critical as it relates to action-based strategies of mental wellness. And then one of my favorite, technology-based, right? We live in the time right now where we have been very lucky to be exposed to a number of very technology-driven solutions and opportunities to help us with our mental health. Without knowing some of the communities that each and every one of you live in, my personal commitment and investment to myself as it relates to ensuring that I'm able to bounce back from that state of mental stress back into the state of mental health is flotation therapy. Putting myself in about 20 inches of water and 1,000 pounds of Epsom salts in total sensory deprivation. We are constantly bombarded with stimulation from the outside world. So to be able to completely shut that off in the form of something like flotation therapy, feel free to offer in chat if you've ever heard or experienced flotation therapy. I know that it does exist in some of the smaller communities that I've gone in and spoken at and been a part of. But more important around this idea of self-care strategies is not so much about the what. There are things that every single one of us here can take advantage of. The question more is around the if, or are you going to be accountable to yourself, right? Are you going to be accountable for you to understand that before I can give to everything around me, to the people that are around me, to my family members, to life on the farm, it has to start with me. It has to start with the cup that I fill all of my passions, personality traits, elements about myself, but I'm so prone to give to others first. It has to start with us. This was one of the biggest lessons that I learned that started my road to recovery, that I deserved another chance, as difficult as it was for me in the early stages, for me to believe that with all of the hurt that I had caused so many people around me. But it has to start with us. We have to be able to take that drink from the cup first before we look to give it to others. Resilience is a skill, is a trait, are elements about ourselves that are very much learned. In our data and science and literature, it speaks to this. And it just so happens that every single one of us, every single one of you that is here in attendance today, are some of the most resilient people that we have ever had the opportunity to meet and to learn from, especially coming from this profession and this livelihood of being in rural Saskatchewan or rural communities. So when we think about the idea of resilience, the process of adapting well in the face of adversity, trauma, tragedy, threats, significant sources of stress, I want to be very clear that in order to live with resilience, we do not have to have experienced devastation. We do not have had to experience complete tragedy or loss in our lives. Because when we think about resilience and some of its fundamental definitions and understandings, resilience is also bred from the way that we deal with uncertainties, the way that we deal with change, something that defines people who live in rural communities and who are farmers by nature, right? Who are in that profession, who are surrounded by that life every single day. One of my favorite motivational quotes from a motivational speaker, Les Brown, that you're either in a problem, just left one, or headed towards one. How true is that of someone who lives in rural communities and who is a part of the lives that every single one of you are? When I say that resilience is learned, it is a skill. I spend upwards of half days talking about these specific 10 skills and abilities that literature and research tells us we have the ability to work on. We have the ability to dedicate and be intentional to work on all 10 of these. And I'm going to speak to just a couple of them that I think are very, very relevant to our population, our demographic and our audience that are here with us today. But the skill of making connections, especially within rural Saskatchewan, rural communities, and in the farming life. We already know the extent of isolation that is a part of your day-to-days. Being intentional about meaningful connections every single day can make such a huge difference for us during those times of struggle and stress. By making connections, we strive to have caring relationships, to give empathy and to receive empathy, to trust and be trusted by others. Making connections serve as the foundation for all of the other 9 skills and abilities, things that are within our control to build, that you see on your screen here around building resilience. Another big one for you, focusing on the things that you can control, right? Not to minimize those uncontrollables and the vast array of uncertainties that make up every single one of your livelihoods. But we have to remember the human capacity for hardship is very much like a bamboo. It is far more flexible than we think, and than we sometimes give ourselves credit for. When we focus as much as possible on what's in our control, we're better aligned to learn from our experiences, to take a step back and to put things into perspective a little bit more effectively. And the other one that I want to mention to you all very quickly here, number 8, the importance of embracing vulnerability. I told, as per my story at the beginning, embracing vulnerability as a strength, listening to the stories of farming professionals, distributors, producers, your families and friends and your neighbors. Doing so for me, meeting the likes of yourselves, Nutrien, Do More Ag, has brought, for me personally, some of the most inspiring stories of resilience and strength. listening to some of the stories of some of the things that you've had to deal with, not just over the last 2 years during the pandemic, but as your way of life. To tell your story, it does require for you to let down your guard, to be vulnerable, to be honest with yourselves, and to potentially share something very, very difficult that also allows you to move past some of those challenges. But in addition to moving past yourself, to help somebody else who might be going through one of those difficult moments or some of those difficult moments. So embrace vulnerability as strength and not a weakness. I'm curious to hear from any of you as we kind of conclude and lead into our Q&A portion here. But when you think about self-care, stress management, coping strategies, feel free to throw into the chat right now some of the things, share with your colleagues here today, some of the things that you've engaged in as it relates to self-care over the last couple of years, recently, things that you adopted from early life that you have carried into your way of life now as an adult. Feel free to take a couple of minutes just to share anything that you would like to share with others. I would also like to challenge every single one of you here on the topic of self-care to spend some time, to take a step back and to think about what are 3 things that I can adopt, that I can be mindful of to engage in. But then even more so than that, go into some greater detail. How are you going to do it? Who can support you? Who can hold you accountable as part of your day-to-day life? Because it's important for us to spend that time. Knowledge is power, and the importance of having conversations and seeking help. The stigmatizing image of folks in this livelihood, in your livelihood, that you have to have thick skin, that you have to be tough, that image of the farmer that we've become accustomed to understanding that defines someone in this life. It only contributes to stigma and it only makes things worse. What helps is to have those available resources, community resources, and continue to work towards building networks and building supports of like-minded individuals such as yourselves to carry those conversations and to share knowledge and resources. With that being said, before we open it up to any questions, comments, requests for clarification, I just want to thank every single one of you for taking the last little bit of time to listen and to share and to think about things that I think are really, really important for us to continue to build this momentum around creating healthy communities within rural communities. A brief feedback form is going to be emailed to each participant, all confidential, considering that we very, very much value your feedback to ensure that these learning and development opportunities are as meaningful to you as possible, which will serve to help develop future projects and by additionally better understanding topics that will be of value to every single one of you. So stay tuned for that. With that being said, one last thank you to everyone in attendance here, and we'll open it up to anyone who has any questions, comments, or requests for clarification.
Thank you, Adam. Really appreciate your presentation and going through not only signs, symptoms, but also some of the coping mechanisms and keys to resilience. As you're watching the clock, you need to, in your evaluation form, critique your facilitator or the person who's supposed to be keeping us on time. I didn't interrupt because it's such an important topic. And what I'd like to ask for is your permission to extend just to 11:15. So a few minutes to take on the questions. So Adam, and this is open to others as well, but we have a question that has come in, a couple questions. So someone I know seems to be struggling with their mental health recently. What should I do?
That's a really good question, and one that can be very complicated when you look at all of the different layers in terms of what we're talking about when we think about something like supporting within our means. But one of the most important elements when we see that someone is struggling and we want to feel empowered to do something about it, being supportive to someone is noticing that they're struggling. because we have to understand that not all of us, the majority of us, are not medical professionals. So when we think about that question, what can I do to support someone? What should I do? Go back, take a step back, and bring in fact-based noticeable observations. The last thing that we want to do, and I can speak to this from experience, is to bring perception into that conversation with someone, right? Because they'll come back and they'll be defensive and they'll say, how dare you say that I'm doing this or think that I'm experiencing this? When we're able to pay attention to the fact that someone is struggling with fact-based noticeable observations, for example, hey, Adam, normally I know you are kind of the life of the conversation when our crew gets together to have lunch. But for the last couple of weeks, you've been isolated, you've been alone, you've been separated from the rest of the group. I've noticed this. Is everything okay? Someone who's going through a mental health problem, the internal stigma that they carry, it often tells them that nobody is paying attention to what it is that they're experiencing. So when you're someone who can go in and say, hey, Adam, I am noticing that you're struggling. I am noticing that there has been a shift, a change, something. Not only does that break down that stigma, but it shows that person, you know what, they are paying attention. That creates a higher likelihood of them opening up in those circumstances. So one thing that I would strongly suggest to bring in those fact-based noticeable observations.
Thanks, Adam. I've got another question. What kinds of supports are available for those who are living with a mental illness themselves, or someone they love or care about is suffering? I do want to premise this question by thanking you for the listing of lines, toll-free lines that allow us to seek out and connect with people that are experts in this area. So what kind of supports are available?
Yeah, I think this goes back to that idea of, once again, that knowledge is power. The more knowledge that we carry around supports that are available internally through, rural communities, through organizations like the Do More Ag Foundation, and like bodies that create some of those more internal to rural community supports, to try and network and get people, like-minded individuals who share some of these stressors, who share some of these challenges and opportunities to build supports, build networks and build resilience amongst one another's. But the idea that knowledge is power, we have to be willing to understand internal, external supports that might be available. So reach out to your communities, reach out to some of those supports that are here, even in attendance here today, and start to network and to share some of those opportunities to break down that stigma, to break down those walls, and to continue some of these really important conversations.
I've been trying to support someone who's been dealing with a lot of stress, but I'm so tired from constantly giving and helping. What's wrong with me?
Absolutely nothing is wrong with you. Supporting someone, and I can speak to this again from kind of the other lens, as being that person who has needed a lot of support over the years. Being almost 10 years removed from the last time that I placed a bet, it has not resulted in some of my approaches to staying on that healthy path. There have still been a lot of challenges. There have still been reminders of the fact that I am one decision, 1 second away from going back into that life. And so being tired during that supportive process is very, very natural. And one of the things that we have to be mindful of, if you find yourself supporting a family member, a friend, a community member, someone who might be going through something, just because you are supporting them does not mean that we never stop holding them accountable. And in doing so, we have to understand where those boundaries lie, right? When we have to be willing to say to that person that we might love very deeply, care for very much, that, you know what, I love you, but no, You can no longer continue to take advantage of me in this fashion, in this light, in this way. And that's very, very difficult. That doesn't make it easier for any one of us in that relationship. But those feelings of feeling drained are very, very natural during these times and in these processes. You have to, though, take that step back from the lens of self-care. What is best for me? It is difficult. It is a difficult conversation to have with yourself, but what is best for me in this moment, in this relationship, sometimes needs to be the conversation. Great question.
Thanks. And I wanted to thank everyone for these questions. I do want to point out that today's presentation is available to download in the Files pod to the left of this chat. Also, Kendra Ulmer references the Farm Stress Line in Saskatchewan as a resource. Don't hesitate to use the infrastructure that you have available in rural Saskatchewan. There's certain advantages in the cities. We have a tendency to have maybe more services available to us within a very short geographic distance. But the real advantage in rural Saskatchewan is to be able to go to your local health center or hospital, to speak with your family physician, to speak with an ER team, and to be able to get the right referral and connection into the care system. I think what we've learned today is recognize the symptoms, be there for each other in terms of support. This isn't licensed to now be the replacement for professional care, but rather early warning system, an indicator that we may need help ourselves, and have the courage to step forward. Adam, I really appreciate your honesty and your courage to tell your story in this. And that's not gone unnoticed, that humility and ability to share. Each of us struggles in some way, or we know someone very close to us that is struggling today. Seek the care that you need. And I want to thank, and bring this to conclusion, I want to thank Adam. I want to thank Kendra and Niels for the good work that you're doing. There are many more questions. The great news is we're prepared today to be able to ask those questions and to seek the care that we need to make sure that we have the mental health that we desire to live happy, healthy, and productive lives. So to each of you, thank you for taking just a bit more than an hour to join us. And Kendra, Niels, Adam, I want to just show maybe a virtual thanks to each of you for your work, your presentation today. And I'll just, my own show of support, and others might join me in their own way in saying a special thank you. Everyone?
Thanks. Thanks for that.
Go
Just
ahead,
a couple of quick words. First of all, Adam, again, thank you very much. And I noticed one more question from Wade in the Q&A, so I'll touch on that in a second, and maybe the others have a comment on that if we have one more minute in our extended time. To that first question, Adam, I think it's human nature, and there's always it's a skill to be able to listen and to make yourself available to just listen. There's a natural tendency when someone finally musters up the courage to present what's going on with them to you, to want to solve it. I think that's human nature, to instantly try to come up with something and say, here's what you need to do, and to fix it. And that, I think being able to just make yourself the recipient of that, and to listen, and to not necessarily try to solve that issue right away, but to be a person or a resource or someone that person can confide in, I think is a skill and takes practice, and it's hard to do. But you touched on that, and I think that's a crucial piece of that. Wade, and thanks for that. Wade, you had asked about evidence-based solutions, and I think that's crucial to how we move forward in addressing this issue, right? And I think we see it in addressing other issues, other health and safety issues, in farming and in industry, whether it's a chemical hazard or a physical hazard. The interventions are based on evidence, and they're based on things that have been looked at and things that we know that work. And mental health is no different. I think you're absolutely right. And recognizing the problem is important, but focusing on solutions that have been shown to work that are evidence-based is crucial. Thanks for bringing that up.
Thanks.
And I just want to also say thanks again to the ministry, to SARM for giving us this venue, and Adam, to your time, and Dan for your leadership here. Thank you for that.
Thanks, everyone. And special shout out to SARM for allowing us to do this. We need more of this. So Adam, thanks. Kendra, Niels.
Thanks everyone for joining.
Bye-bye.
Thank you all. Have a great weekend.